Kia ora tātou. David Tipene-Leach tēnei. I'm the chair of the Maori Doctors Association called Te Ora. Maori doctors have been involved with the COVID response since it began, indeed before it began. We have been hugely supportive of the public health response to COVID in Aotearoa. We've been on the front lines, we've been in primary care clinics, we've been in the hospitals, we've been at the CBACs, we've been responsible for keeping services open in Māori communities. We have been working alongside all our other colleagues in this response. And yes, we've also been taking another role. We've been taking the role of reminding the government of the things that it should be doing around making sure that there is resource for the response in the Māori community, about making sure that it should be appropriately counting the number of Māori, properly counting the number of Māori who have COVID, making sure that there's no transmission in our communities, checking up on the whole community transmission thing, because you and I both know that if COVID gets hugely into Māori communities, it's going to go like wildfire. So we've been involved big time in that. But we've also been involved in promoting how to prevent COVID through things like this, through little wee mini broadcasts like this. We've been highlighting delays in services that have been happening as the hospital service has been reconfigured to account for very ill people. And you know that diagnosis and screening programs and operations and those sorts of things which hugely impact upon Māori have been delayed, and we're making sure that those things are getting up and running as quickly as possible and make sure that Māori people get back into those lines as quickly as possible. We've also been watching out for our colleagues. We've been watching out for burnout. We've been taking care of each other, so to speak, but we've also been the spokespeople, not just for Māori, but for other people who are, well, in a difficult situation. For the poor, for the homeless, for the dispossessed, for those in prison, and indeed for the disabled. So you can be assured that your relations, Māori doctors across the country, have been working selflessly in this COVID campaign alongside their health workforce colleagues, Māori, Pākehā, Pacific people, nurses, lab technicians, midwives, pharmacists, psychologists, navigators. We have been there. Nō reira, me mihi atu au kia kōtou katoa, kia haumaru nei kōtou I roto I ngā o kōtou miru me ki roto tonu I te rāhui. Nō reira, tēnā kōtou.